Mr. Rakesh, that brings me to another question. Are there many institutes or places like yours? As an investor, can I invest in other places? And if I decide to invest in PREVIU, why specifically there? What is it that you offer me?
So we have probably the only test in the entire world today which can actually detect cancer at stage 0 and 1 just through a blood test. And that's something which is only you will find with us. And that actually, detects 35 types of cancers. And we have a lab actually based in Bombay, and we can take the blood draw from anywhere in India, and we do something called an mRNA sequencing, which is a bit technical, but what it does is it detects, the incidences of cancer pre-tumor. Normally if you see the protocol, cancer detection happens always at stage 3 or 4. By that time, it's already late, and the economic burden and the mental burden on the patients and their families are very huge. But this actually allows them to detect cancer early, and while they detect, in many cases, even nutrition can kind of fix a lot of these issues quite early on, and then after that, what it takes is just a couple of sessions of immunotherapy or whatever, and the patient goes back to normal life. That's the entire intent. So I think Sri Krishna can add a few more.
Sure. I think one is, if you look at the cancer itself, on the preventive side, right? So we have a complete product and suits on the preventive side. We promote HPV vaccination for cervical cancer. Right? See, so cervical cancer is the second largest killer for women in India. Right? It has a huge incidence, and if you detect early, correct, first form of defense in cervical cancer is HPV vaccination. So PREVIU is, it's not just on the treatment side. We are also there right from the preventive side onwards, right? The journey starts there. So HPV vaccination is one of the key things for us on the preventive side. The second part of it is an early detection, as he is talking about as an HRC test. And then we also cover the care part of it through our distributed cancer care. So if you look at it, not many centers today we can boast of from prevention all the way up to the care, the entire spectrum that you are looking for in a cancer care, right? We offer everything under a platform.
Well, that's good to know. And now I know that Mr. Rakesh Menon, you are the founder of PREVIU, and Mr. Sri Krishna, you're the co-founder. But for an investor, he or she would want to know the team behind it. If we can trust the entire team, do they have experience? What is it that the entire team offer, and how many places you have the centers in and stuff like that? So who all are behind PREVIU?
So PREVIU is fundamentally a doctor-led, kind of a company. And the reason is, while we have extensive experience in the healthcare space, we also have in-house medical oncologist. We have radiation oncologist. We have MDs in general medicine. We've got scientists on board who are focused on research and development. We have also tied up with institutions like ISB for studies where we can use AI for population where we are screening actually. So it is an entire ecosystem by itself where we have a very eclectic mix of scientists, doctors, marketing professionals also, because the messaging has to go, because we need to break the stigma and create the awareness. So we are probably one of the only kind in the whole world. I wouldn't even say in India. I think globally as such. And our aspirations also is to set up centers, at least 100 centers pan India over the next 5 years. That's what
Absolutely.
we're trying to do. Yeah.
I think also cancer is not just around the treatment alone, right? It comes up with a whole lot of support system, whether it is a nutrition, as I think Rakesh touched briefly on. Look at it, right? Onco-nutrition is a huge subject actually. The way people want to be go through the nutrition supplements and things like that. So when we look at cancer, so PREVIU takes it as a holistic approach to that. As I said, prevention is one side of it, but then treatment itself becomes an collaborative care. So that is where our technology platform helps us actually, so, people from doctors, nutritionists. We have actually our preventive health director, so who's focusing only on preventive health. How do you do on a large scale awareness sessions that we are talking about? What kind of a preventive measures we can take on? So I think it's PREVIU per se is a beautiful team that has formed together. I think we are blessed in a way that, different walks in life, people, all of them have, like the way you told, all of them have some mission-oriented feeling when they come on board of the PREVIU.
And then the proof of the pudding is that we have already raised our pre-seed, and we have been blessed with the fact that we have gone through a whole deal of due diligence by PwC PricewaterhouseCoopers, which is one of the top 4 consulting companies in the world today, and we have been invested by a UK fund. And then after a very rigorous due diligence. So we are well on our way to establish our first 10 centers. Our technology, we have actually, it's our own technology. It took us a few years to so that's proprietary technology which we have. So we have a lot of positives which we are currently, and like he told, in terms of holistic treatment, we also look at not people who can just pay. We also work with the organization who has CSR funds available, for example, running mass vaccination drives. That also translates into, ensuring that the people, that bottom of the pyramid is also getting covered, right? That's also important, right? As part of the mission. So,
yeah. So Rakesh Menon, you said about the next 5 years.
Yeah.
That was my very important question. As an investor, when I put my money somewhere, I would want to know, especially when it is one of a kind of a company and stuff like that, this is something that you are bringing to the world. I would want to know where I will stand after 5 years with my money. So I would want to know where you will be after 5 years with my money.
So I think from an investor perspective, and this data is completely there, out there. With the kind of product service proposition we have, typical valuation which we can look at for a tech investment is around 20x. And when you add the fact that we have bulk pharma, chemo drug supplies, right from manufacturers, we have the tests which are uniquely ours. It averages out to a very conservative 10x. So anybody who comes in with 1 rupee can safely exit after 5 years with at least 10 rupees. I think that makes it very, very lucrative for them.
And what if I ask you about the next 10 years? Where do you see yourself?
So I think we are already going global right now because developing nations, in fact, next week I'm in Dubai and we are setting up a setup there to set up centers and because UAE also is kind of a hub for Africa, and we have been really called by African nations to come and solve the cancer problem. So the entire vision for PREVIU is global, though we are a pure make in India company, so we're inspired, and the first thing is homeland, but after that we take what we do globally.